Yeah, I was just talking about the difference between developmental OCD and OCD that happens later on in a person's life, and the difference between them, and how some types of OCD are being developmental. The person is more or less born with, and is always going to have OCD, and but it shouldn't be looking for a cure sort of thing. And I feel that medical professionals, psychiatrists, psychologists, people like that, should be aware of the differences and not treat all people with OCD or other mental conditions the same. And just because you can't cure something doesn't mean a person can't be helped. There's often this kind of belief in psychiatry that if someone can't be cured, they're being refractory, or they're being difficult, and we can't help you because the only outcome is cure, and they won't settle for anything less. Whereas actually some people are just as much deserving of therapy, but the aim isn't cure, it's more helping them to manage the condition. And I also feel that in psychiatry there's a lot of emphasis on everything having to be achieved by a certain time scale, so it's all quick, we need to cure you, quick, you've only got 8 weeks. Whereas actually some people need long-term therapy to really help them manage their condition. It's about management, not cure for many people, because for many people these conditions are chronic. There's a difference I feel between chronic mental health and acute mental health, okay? That's something else. I also feel that thinking about a cure and telling someone, making it out as though we can cure someone, can sometimes actually be quite offensive, even if the person's not trying to be offensive. It's almost like implying the person, the psychologist or psychiatrist or whatever, is basically like a godlike figure who has total control and can basically cure you, or something like, or if you don't get cured, there's something wrong with you because you're not complying or whatever. It's aiming for the impossible for some people, and I just feel it's not very sensitive or humanistic. So that was something that the person said that I'm thinking was the one gripe I had, but because she seemed nice all in all, and because the other thing she said seemed really good, I'm trying not to let that affect me, because otherwise I'll be waiting for therapy for years, and pretty much every therapist I speak to is going to have something about them that I'm not keen on. So, but yeah, I just hope that as long as they're not dead set in that view, and maybe I could talk to them and just explain how my OCD is developmental, then they might understand it and not try and cure me, because I don't want them to feel they can cure me when that's not possible. And that suggests, because basically, if you could cure my OCD, I mean, no one's achieved it yet, and I've tried. I spent most of my 20s trying, and it didn't happen, and then I just have to accept that realistically I'm always going to have it. You have to accept it. That's part of my acceptance. So trying to change my acceptance is also not very good for my mental health as well, because it kind of is ego destabilising, because I've accepted it. It's like that's part of my not identity, that's the wrong word, but it's part of my well, when you accept something, it's kind of closure, isn't it? And then someone's suddenly saying, oh, we can cure you. It's like, okay, that's quite destabilising. And I've got to the point where I'm just accepting the fact I'm always going to have OCD, but I don't want it to mess up my life as much as it is. Now, obviously, as I'm saying, with COVID, it's a difficult situation, because COVID is a real risk, so it's not all completely in my brain. Some of it is OCD, yes, but some of it is actually logical. And the other thing is that my OCD, this is the other thing that would be interesting to get your perspective on, but there are different types of OCD, and my OCD is very, very logical. So it doesn't involve fears about hurting anyone. It doesn't involve thinking, oh, if I haven't counted to 3, something bad's going to happen, or something like that. My OCD is very, very logical, probably because I'm autistic, but it's very, very logical. So all of the fears and phobias and OCDs I have, people without OCD would also be cautious about or worried about. The difference is I take it to the next level. That's the difference. I take it to the next level. I mean, I do have some checking OCD, although it's not based upon sort of fears around something supernatural happening if I don't do it X number of times. It is still logical, but that's more, I have a feeling that's where the interplay of autism and OCD happens. Like, my autism likes to do things on repeat, repetitively, and I find it hard to stop actions. And then obviously my OCD has the anxiety, like for example, I have to check the cooker, for example, before I go to bed, and I have to stare at it a set number of times to convince myself everything's off and everything. Some of that is OCD and anxiety based, but also there's the autism element there as well, about finding it hard to stop an action and repetition and stuff like that. And it's kind of part of my routine, and that's also how it interlinks with autism, is that when something's part of my routine, it becomes very hard to stop as well. But I'd say the checking OCD isn't as bad. I mean, it doesn't stop me doing other stuff. It's minimally annoying. Well, it is annoying, but I wouldn't say it's like that disabling. And thankfully, it's not as bad as some people have it. Like, I'm not like spending hours checking it. You know, I mean, it might take a bit longer than a normal person just checking it once, but it's not like, it's just something I have to do. Once I've done it, I'm not thinking about it still. So it's not like really disabling or anything. And I would say it's a little bit different to sort of like the really intense OCD that some people have, which causes a lot of distress. And I would say it's kind of, again, where the autism does interlink a bit with OCD, but they both play off each other. The most disabling issue I have is obviously my germ phobia, which is a combination of OCD and extreme avoidance, with around getting disease and getting ill, which I've had as long as I've been aware of germs. But obviously it got a lot worse when I was a teenager. As a child it wasn't too bad, it came in waves as a child, but it wasn't too bad as a child. Like, I didn't avoid things as a kid, so it wasn't like that much there. It was like just a small amount in childhood when people told me about germs and I took it. And also a lot of it was taking things literally as well, which is where it feeds into the autism. So yeah, I do feel my OCD is a bit different to the classic OCD, which is why I sometimes find it hard to relate to people with like more classic OCD, because I do feel my OCD is developmental and I do feel it's very much interlinked to my autism, which is why I don't feel it can be cured, because some of the reasons behind my phobias, like germ phobia, is to do with my fear of change, which is connected to my autism, but it just takes on a phobic level because it's such a big part of my autism. Then that obviously makes me vulnerable to developing a type of OCD connected with it, if you see what I mean. So they kind of, in a way, feed off each other. Because I'm really worried about change, which is a big part of my autism, and that then results to anxiety, and that then triggers the OCD. Because obviously getting ill does obviously involve change, and with COVID even more change, like isolation and all this stuff. The uncertainty of it, you know, the lack of control, I need to be in control at all times. And obviously when you're aware of germs and you're aware you can avoid this situation if you don't catch the disease, then obviously that feeds into a cycle of avoidance, where you end up basically, because it is true, you know, if you avoid people, yes, you won't get ill, then I can avoid an outcome that could be very traumatic for me. But obviously, the other side of the coin is that then I narrow my life, and that isn't tenable. So I have to try and achieve some balance where I'm not completely limiting my life, but at the same time I can try and navigate the risk, yeah, sort of like, not completely avoid people, but, you know, kind of navigate the risk, and maybe also try and become better able to deal with things when they go wrong, because I'm not very good at that. So that's what I'm hoping a therapist to help me with. If they can help me maybe feel more competent about dealing with things when they go wrong and having strategies to deal with it, that would then reduce my anxiety, bring my anxiety down. But obviously it can never completely go away, because unfortunately part of being alive is that we do sometimes get ill, so I'm always going to have this worry. But it's part of my autism. So yeah, you see what I mean? It's kind of like, you can no more cure my OCD than you can cure the autism, because the autism is the underlying reason why I have OCD. Now obviously not all autistics have OCD, because we're all different, but other autistics there might have depression as kind of triggered by their autism. Thankfully I don't have depression, but it all depends on how our brains are wired up and what we're susceptible to. And I'm very susceptible to anxiety, clearly. So that's part of my neurology, really, and yeah. But anyway, I'm going to stop now, but do let me know what you think, because I'll be interested to know. So I'll let you know how this therapy goes, and hopefully, touch wood, it's a good one, but we'll just have to wait and see. So thank you for watching.